About 2.2 million people in the United States and around 51 million people in the world could be suffering from schizophrenia at any one point in time. Schizophrenia, as with many other mental diseases, receive a negative stigma in American society. They can be seen as extremely violent, and many people assume schizophrenia and dissociative identity disorder are the same thing. It seems that people with mental illnesses are often believed to be violent because movies typically portray them as psychotic killers. Sometimes people with schizophrenia wind up homeless, and this gives the general population an idea that they are not capable of functioning on their own. Schizophrenia is a mental disorder that makes it hard to tell the difference between what is real and what is not real. The symptoms include hallucinations and delusions. While in some cases of schizophrenia, it is seen that patients act out in a violent way or develop the disease so early in life that they aren't able to function on their own, not every case is like this. In an interview with the director of CAPS, a psychological center at the University of Richmond, I get the doctor's opinion on schizophrenia, informed consent, and stigma. Okay, can you start by introducing yourself?
Yes, I'm Dr. Peter Levinas, director of CAPS and licensed clinical psychologist in the state of Virginia.
Okay, and do you have any personal involvement with schizophrenic patients, or do you know anyone with schizophrenia?
Yes, I've worked with patients with schizophrenia in the past. We have relatively few who are UR students, but we do have some.
Okay, and would you say that these patients are capable of giving informed consent?
I would say largely yes. I think there's a lot of stigma that folks with schizophrenia face. And a lot of times people want to make decisions for them, or I think they know better than them, but I think, except when they're in the midst of a delusion or a hallucination or that kind of stuff, when they're acutely symptomatic, most of the time I think they're fully capable of making informed decisions, and that we should assume they're competent unless there's a really strong reason that they're not.
Okay, and so I've heard specifically that schizophrenics typically have a high risk of causing harms to themselves. Would you believe that was true?
I'm not sure that's true. I would say there's also an overestimation of risk of violence to self or others among folks with schizophrenia. I think you'll see it in the media. I think that's another form of stigma. Just about any time you see a crazed murderer on a movie or TV program, they're made out to be like a schizophrenic ex-mental patient running around wreaking havoc. I think when you factor out things like gender, age, substance abuse, the risk of violence with someone with schizophrenia is not much higher than the rest of the population. I think there's a few elements. If you have paranoid schizophrenia, like with command hallucinations, that could increase the risk of violence, but short of that, a lot of folks with schizophrenia are no more violent than anyone else.
Okay, and let's say that there was a patient who was at risk of harming themselves or others. How would you go about keeping patient-doctor confidentiality?
Depends on the degree of the risk. We're obligated to get the person to safety or protect life if it's at a high risk. So if we think someone's likely to harm themselves, and we don't think that their safety, the protective factors would stop them from doing that, the risk is high enough, we would be trying to get them into a hospital. Ideally voluntarily, but could be involuntary if the risk is high and they're not willing to go. But that's true with any patient that's suicidal, not just someone with schizophrenia.
Yeah. Okay, thank you so much. That's all the questions I have. In Dr. Levinas' opinion, he seemed to believe that many schizophrenics are capable of going to school, not becoming violent, and giving informed consent. In the case of a man by the name of John Forbes Nash, this was true. He was a famous mathematician. He lived his life very normally until he developed schizophrenia. He began to believe that anyone in a red tie was in a communist conspiracy against him, and he even proceeded to inform the government, and then he was hospitalized. He stated that, quote, "I spent times on the order of 5 to 8 months in hospitals in New Jersey, always on an involuntary basis and always attempting a legal argument for release." In this case, it seems that Nash should not have been treated against his own will, and that he was very capable of giving consent. On the other hand, there are extreme cases like that of Janie Schofield. As young as 2 years old, she began speaking of imaginary characters she would see. Animals and children will talk to her and tell her to do things. By the age of 5, she would scratch herself until she bled, and even tried to scratch her father's eyes out because she said if she didn't do these things, the characters she saw would bite and scratch at her. She has been to the doctor several times and placed on heavy medication. She is even kept from her younger brother because of her extreme acts of violence. In this case, it would be very hard to get informed consent from Janie herself because it seems that she is being controlled by another world. Schizophrenia typically develops between the ages of 15 and 25, therefore in most cases a higher level of education is not obtained. Schizophrenics also have a 20 to 40% chance of committing suicide. No two cases of schizophrenia are ever exactly alike, therefore it cannot be certain whether or not schizophrenics are capable of giving consent based on the disease as a whole. The capability of understanding one's disease and giving treatment seems to be unique to each individual.